All right, all right, everyone. It's Dr. Lisa L. Campbell back with part 3 of your week 7 lecture for Introduction to CPT and HCPCS coding. We finally made it to our very last section. And this particular section is the medicine section. I like to call this the garbage can section because basically everything they couldn't fit into the other sections is literally over here. So let's just dig in. So, literally, everything that they could not fit into the other 5 sections is over here, right? So, we're going to go through some of the areas, not all, but you're going to see all different types of services. So, starting this subsection off is immune globulins. An immune globulin functions as an antibody for a short period of time. This passive immunity occurs as the immune globulin circulates through the body. The basic structure determines the type of immunoglobulin function. The code range is 90281 through 90399. And these particular tests, or I'm sorry, vaccinations, injections, are administered intramuscularly. Most of them are intramuscular. I will tell you that there is a note that is at the beginning of this area that tells you that you're not to use the vaccine administration codes for the immune globulins. You're going to use codes that we'll see much later in this presentation. I bring that up because the very next set of codes. So I guess I think one thing I should say, the this is something that's administered, but I think if you can keep it straight in your head that these are immune globulins, then as we get into the next area, we're going to talk about vaccines and toxoids. So, immediately after immune globulins, what you actually see are the codes that reflect administering a vaccine and a toxoid. When we give these injections, we need a code for the little bottle itself and then the act of administering it. But these right here are for vaccines and toxoids. I want to be very intentional about that. So we have pediatric and adult vaccine administration. And what you will notice is that the first 2 codes, and hopefully you have your CPT manual open, the first 2 codes is for immunization administration through age 18, and the fact that face to face counseling to the patient or family during the administration is done. So, you know how like kids get vaccines and the doctor says, "Oh, you might have a fever, et cetera," right? That's the counseling. So, the other thing I want to call out is that these first 2 codes in the description of these codes identify that the first code is for the first component, and then the second code is for each additional vaccine or vaccine component provided. With these first 2 codes, um, the route of administration does not matter. So if it's intramuscular, intradermal, sub-Q, percutaneous, doesn't matter. It's literally um, through age 18 when counseling, face-to-face counseling is provided, and then you go on from there. So immediately after that, you have 4 more vaccine administration codes, which are 90471 through 90474. And these codes are for patients um, 18 and over, or a kid when there's no counseling. So remember those first two, it's all about that counseling. Okay. So these four codes are organized based on the route of the administration. And so you'll want to pay close attention to that. And then we have codes to reflect each additional vaccine. And then I think it was for 2025, we have a new COVID vaccine administration. When the COVID vaccines first came out, we had all kind of options based on the manufacturer. And so 2025, they got rid of all that differentiation. All right, let's keep on rolling. We got a lot to cover. All right. So next up, we have. Oh, you know what? Something else I just wanted to. Um, yeah, I realized I skipped something. So I talked about the vaccine administration, but now we need the vaccine product. So a vaccine is a dead microorganism that is administered for the prevention or treatment of a disease. A toxoid is the actual bacterial exotoxin that has lost its toxic effect but kept its ability to produce antibodies. And a live vaccine is one that was prepared from a live microorganism but has been thinned down and has kept the immunogenic properties. All right. And I keep clicking. So these are the codes for the actual little bottle of vaccine or toxoid that is administered to the patient. You accompany that with the vaccine administration. I still haven't shown you the codes for the administration of the immune globulin, so I want to call that out. Psychiatry. So, psychiatry is the branch of medicine that treats mental disorders, which includes emotional and behavioral disorders. A psychiatrist, IST, is a medical doctor who administers treatment for patients with mental, emotional, or behavioral disorders. And a similar mental disorder can manifest itself in different levels of severities in different patients. The codes that are available here, it starts off actually with an add-on code for intraactive complexity. There are notes in the CPT manual that speak to that. When you use it, immediately after that, you have codes for psychiatric diagnostic evaluations. One is with medical services, the second one is without medical services. So 90791, 90792. Immediately after that, you have psychotherapy. Psychotherapy is treatment of mental illnesses and behavioral disturbances through therapeutic communication. Those codes are time based and are differentiated by the length of the therapy and whether an evaluation and management of service occurred. Again, pay close attention to these services. Then we have psychotherapy for crises, 90930 and 908 90840. All right, so this is obviously a crisis situation. After that, you have other services like psychoanalysis, family psychotherapy, group psychotherapy, multiple family group psychotherapy. And then immediately after that, you have other psychiatric services or procedures. And so over there, you'll see things like pharmacologic management, ECT therapy. So that's like, it's a type of therapy used to treat patients with chronic or profound depression when nothing else has worked. All right, and we are moving on to hemodialysis. So we're actually going to talk about a couple of dialysis services. So the dialysis subsection has four parts: hemodialysis, miscellaneous dialysis, end-stage renal disease, and then other. So, hemodialysis is a procedure that removes waste from the blood, but involves a continuous movement of blood from the body to a hemodialyser for filtering and then clean the blood. The clean blood is returned to the patient's bloodstream. So the hemodialyser makes sense for hemodialysis. So these particular codes include the hemodialysis procedure, including all E&M services related to the patient's renal disease on the day of the procedure. Immediately after that, you have miscellaneous dialysis procedures. And so over here, you may see something like peritoneal dialysis. So that's another form of cleaning waste from the bloodstream. Instead of a machine to filter the blood, the peritoneal membrane is used as a filter. And of course, it includes E&M services. All right, ESRD, end stage renal disease. So these codes are reported for a patient who has kidney failure. These codes are reported once a month. For services that are less than a full month, those are billed by day. These codes over here for ESRD are differentiated by age and place of service. Place of service being outpatient, inpatient, or something that is very common today, which is home dialysis. All right, and then your other dialysis procedures, things like dialysis training, hemoperfusion. Hemoperfusion is a way for toxins to be removed from the blood in which the physician perfuses the blood through activated charcoal or resin and then transfuses the blood back into the patient. All right. Next up, we're going to gastroenterology. And I told you everything that couldn't be coded in the other sections, you will see over here. So these are codes for diagnostic procedures on the gastrointestinal system. If E&M services are performed at the same time, we will report those separately. The surgical section for procedures of the digestive tract should be referenced before these codes are used. Procedures of the esophagus are reported first, including intubation and gastroesophageal reflux tests. Over here, you'll also see gastric intubation, gastric aspiration or lavage, gastric saline load testing are covered in this area. Then you also have gastric physiology, and gastric physiology reports the electrical activity generated by the stomach, which lets the physician detect abnormalities of the stomach. We went from the stomach and now we're into the eye. So, ophthalmology, something that is a very common term, most of us know. Ophthalmology is the study of diseases and disorders of the eye. But there's two types of doctors. There's an ophthalmologist, um, and let me just correct myself because the optometrist, which I'll talk about second, is not a doctor. So, an ophthalmologist is a medical doctor who specializes in the treatment of diseases and disorders. And an ophthalmologist can prescribe medication as part of treatment plan, as well as conduct tests and issue prescription for corrective lenses. An optometrist is not a medical doctor and cannot prescribe medication, but is able to prescribe corrective lenses. So when you go to like, I don't want to say the name because they got so many of them, but like Four Eyes, Pearl Vision, I can't think of any more, but those are a lot of places that you'll see an optometrist. All right. Other things that you need to know about this area: refractor testing. And a refractor is a machine that contains a large series of lenses that are changed quickly during an examination as the patient views an eye chart. If you've ever had an exam done, they'll say things like, which one is better, one or two, two or three, right? And they'll tell you, read the line at the bottom. What's the lowest line you can read? A gonioscope is a type of scope that examines the eye for signs of glaucoma. Other specialized services that you're going to see here: contact lens fittings, um, tonography, tonometry, fluorescein, fundus procedures, all things related to the eye. All right, we leave the eyes and we go to the ears, nose, and throat. So here, these are diagnostic services typically performed by the ENT specialist. This is otorhinolaryngologic services. That's a mouthful. And here you're going to see screening tests, such as speech and hearing tests. Next up, we leave the eyes and ears, and now we're over to the heart. And then you're thinking, wait a minute, we saw cardiovascular in the surgery section. Yes, that was surgical services. All right, so the cardiovascular subsection of the medicine section includes codes used to report diagnostic and therapeutic services. And whoa, it's so much stuff over here. Some of the therapeutic procedures that you'll see are stent placement, PTCA. From a diagnostic perspective, over here, you'll also see things like EKGs. And so, additional procedures that you'll see over here: cardiac caths, determining venous pressure, electrophysiological procedures. So, in the surgery section, we saw electrophysiologic studies as well. Over there, that's generally the surgical testing that we saw over there. Non-invasive vascular diagnostic studies. So these codes cover the supervision of patient care, as well as studies and interpretation for non-invasive vascular diagnostic studies. The patient record has to include the documentation of the vascular study as well as interpretation. Okay. Um, it should be noted that a handheld screening device does not constitute enough work for these codes and would be considered a part of a physical exam. And then there's this whole list of stuff that's over there: cerebral vascular arterial studies, extremity arterial studies, extremity venous studies, just to name a few. Next up, we're going over to the lungs. Over here, you will see diagnostic and therapeutic procedures and services. You do need to be aware that these codes include laboratory services as well as physician services, and those codes should not be reported separately. Also, what's included over here is the interpretation and supervision. So, one test that is very common over here is spirometry. That particular test measures the lung capacity of the patient's heart, a patient's lungs. You also, I got heart on the brain. You also have bronchospasm and vital capacity test over here. You have breathing response tests. The documentation is going to be key for coming up with the correct code. Um, outpatient re outpatient pulmonary rehab services, which are covered under code 94625, 94626. These services are completed by a physician or a qualified healthcare professional. These codes are divided based upon if it's without continuous oximetry monitoring or with continuous oximetry monitoring. These codes are a per session service. And again, read the notes, and more notes. Codes from this next section, which are called allergy and clinical immunology. These codes are based on the patient's history, physical findings, and the clinical judgment of the physician or the provider of service. The code descriptions here may also refer to a number of tests that are performed. And the key here is documentation, documentation, documentation. Allergy testing and immunotherapy does not include any additional E&M services, which means they need to be reported separately if applicable. Woo, now we're going to endocrinology. There are two codes found in the endocrinology subsection that are used to report continuous glucose monitoring of interstitial tissue fluid via a subcutaneous sensor for up to 72 hours. The codes for interpretation and report are also found here. When reporting these codes, do not add on a 99091, and these codes are reported no more than once per month. Next up, we got neurology and neuromuscular procedures. Ooh, so many procedures over here. Sleep studies, procedures for measuring the electrical activity of the brain, measuring the muscle, just to name a few. You have neurostimulator analysis testing. So, like, you put in the neurostimulator in the surgery area, and then you get over here, we have the codes to actually test the device. All right, then we have code range 76040 and 97151 to 97158. This over here is for medical genetics and genetic counseling services. There's a lot of notes over there. We also have codes for adaptive behavior assessments and adaptive behavior treatment. All right, then we have health and behavior assessment intervention. Some of these codes are reported in 15-minute intervals, and there are more notes, and more notes for you to pay attention to. Then we have behavior management services, and oh, there's so many notes over there. One of the things you want to pay close attention to is the purpose of the test, because that's going to make or uh, break the code. All right, so look at the notes before um, that define what's meant to be behavior modification service. All right, on to the fun part. Hydration, therapeutic, prophylactic, diagnostic injections and infusions, and chemo and other highly complex drug or highly complex biologic agent administration. So, remember I said earlier about with immune globulins that there was going to be a code that you could use for um, administration of the immune globulin. They're over here, and I'll show it to you shortly. So the first two codes are for hydration. These codes indicate that prepackaged fluids and electrolytes were administered through IV infusion. The nurse usually starts this under the direction of the physician or non physician practitioner, the person who supervises the service. No special monitoring is required. It's generally little risk to giving the patient some hydration. So you dehydrate it, you get rehydrated. Okay. These codes are not intended to be reported by the physician in the facility setting. The facility reports these services. One big deal over here is about start and stop times. They have to be documented for accurate code assignment as to the reason why the patient needed the service. Immediately after that, you have the codes for IV infusions or injections. So this is where So this is therapeutic, prophylactic, and diagnostic. So this is where you will find a code for the administration of the immune globulin. It would just be an injection. Okay. Um, Here with these, this is where, like, so they're not getting chemo right here. Okay, in this range, 96365 through 96381, but they could be getting like IV antibiotics. They could be getting magnesium, just to name a few things. There are extensive notes over here about things like initial service and piggybacks and other things like that. Pay close attention to those notes. Then we go on to chemotherapy. So this is 96401 through 96549. This particular area has three components: injection and IV infusion chemo, intraarterial chemotherapy, and then other injection and infusion services. Again, more notes, and more notes. More than we even have time to discuss. Photodynamic therapy. During this type of therapy, the physician applies a photosynthesizing agent to treat lesions. Some of the codes are reported according to the length of time of the treatment. Documentation has to be reviewed to ensure that the times are substantiated in the medical record. Special dermatological procedures. Here you'll see things like examination of the hair, laser treatment for skin disease, just to name a few. Then we have physical medicine and rehab. So, physical therapy, occupational therapy, athletic training services. And what you'll see over here is that you'll have codes for the actual evaluation and then the code for the actual service. These codes follow a similar look and feel for physical, occupational, and athletic. The evaluations range from low to high. There's also a code for re-evaluation. So usually like every 30 days, if you're under physical therapy, you have to get re-evaluated just to make sure that you uh, still need the physical therapy. Okay. Then after that, you have what are known as modalities, and modalities are divided into therapy that needs to be supervised or therapy that requires constant attendance. So things that are supervised don't require constant one-on-one. It's like whirlpool, electrical stimulation, hot packs, ice packs, all of that. And then the modalities that require constant attendance means that the provider has to be one-on-one. Then you have therapeutic procedures. These codes require the physician or therapist to be in direct contact with the patient. The codes are differentiated by the actual therapeutic procedure that is completed. Some of these codes are reported for each 15 minutes of therapy. If therapy time is required, it has to be in the medical record. All right. And then the last part over here, you have codes for active wound care management, orthotic, and prosthetic management as well. All right. Then after that, we're wrapping up this section. You have things like medical nutrition therapy. These codes are divided based upon the assessment, the initial assessment and the reassessment. And then time has to be documented for these services. Then after that, you just see a whole hodgepodge of services. You see osteopathic, manipulative treatment, chiropractic, manipulative treatment, acupuncture, self management training for the patient, and other non face to face physician services. You also see over here things like home health services, um, the qualifying circumstances for the physicians are over here, the ones from anesthesia. And then you also see moderate conscious sedation. So um, this is something that's different than anesthesia that you saw in the anesthesia section. This is something that they give you in the ED where you're conscious but sedated. And we are done. See you in week 8.